A breakthrough in detection for endometriosis could be a game changer for women. Early diagnosis is crucial for this chronic condition, which causes severe pain and can make it difficult to get pregnant. Women can go years without a diagnosis, but a lab in the Boston area recently launched the first blood-based commercially available test in the U.S. It's a non-invasive test that measures 2 biomarkers and asks 6 questions about the patient's history. The results come out either positive or negative, and the researchers say the rate of false positives is almost zero. I'm joined now live by Dr. Melissa Quick, a family medicine practitioner with Premier Health. Thanks for being with us.
Thanks for having me.
First of all, how can a blood test for endometriosis change the way that doctors and patients manage this condition?
It just gives us another tool in our toolbox to aid in early diagnosis for this condition. The mainstay and gold standard for diagnosis does still remain laparoscopic surgery. The blood test is currently not approved by insurance companies. It's about $300, but women can do this. And if it comes back positive, it may aid them in deciding to seek treatment earlier. And it may help them and their physicians decide if moving forward with a laparoscopic surgery is in their best interest.
This lab says they can get results back to people in days. How long has it historically taken for women to get a diagnosis with this?
Yeah, historically, once the suspicion is there, moving forward with a laparoscopic surgery can take weeks to months to get scheduled. Where the blood test will come into play is moving that clinical suspicion up for women so that they may seek to move forward with the surgery sooner.
What happens when endometriosis goes undiagnosed?
Yeah, it can be quite debilitating, significant and severe pain, and it also can cause infertility.
And for women who are watching that may be wondering now if they have endometriosis, what do they need to know and what do they need to watch for?
Yeah, so heavy, painful periods can be an early sign of endometriosis. Chronic pelvic pain or pain with intercourse and bowel movements can also be a sign of endometriosis.
Do you think that a test like this is a real game changer? Is it something that, hopefully will become widely available and maybe covered by insurance?
I think it's a tool in the tool chest. I think it may bring women to seek care earlier, and it may increase clinical suspicion so that we would get move forward with laparoscopic surgeries earlier than we may otherwise. And so I think it might be helpful for some women.
What are some of the scientific strides that still need to be taken when it comes to women's health?
Lots, but early detection of things like endometriosis, better treatment options, and then of course early detection for gynecologic cancers and breast cancers, as well as better treatment options for those.
All right, Dr. Melissa Quick, a family medicine practitioner with Premier Health. Thanks so much for being with us this evening.
Thanks for having me.